Welcome, Dr. Malpani. Thank you for coming to the show to answer some questions on infertility.
Thank you very much. It's an honor to be here and share my knowledge with the audience.
Let me just start by saying to the men in audience that if you're experiencing any problems in conceiving, pay close attention since we will be covering this topic as well. As we know today, it's not always the woman's fault. Isn't that right, Dr. Malpani?
Absolutely.
Before we start the show today, we have collected some questions from viewers at home and in the studio regarding this issue, so let's start on the first one. Is it true that a man can judge his fertility by the thickness and volume of his semen?
Well, semen consists mainly of seminal fluid, secreted by seminal vesicles and the prostate. The volume and consistency of the semen is not related to its fertility potential, which depends upon the sperm count. This can only be assessed by microscopic examination, so therefore we can't judge the man's fertility just by looking at the semen.
I hope that answers your question. Here's another one. This comes from an anonymous woman. Does a retroverted uterus cause infertility? If the uterus is tipped backwards, will the sperm be able to swim into the cervix?
About 1 in 5 women will have a retroverted uterus. If the uterus is freely mobile, this is normal, and is not a cause of infertility. This is not an indication for surgery.
What about the myth that says a couple should be having intercourse every day to achieve pregnancy? How does that work exactly?
Sperm remain alive and active in the woman's cervical mucus for 48 to 72 hours following sexual intercourse. Therefore, it isn't necessary to plan your lovemaking on a rigid schedule. Although having sexual intercourse near the time of ovulation is important, no single day is critical. So, don't be concerned if intercourse is not possible or practical on the day of ovulation.
Okay, then is the saying that a woman ovulates from the left ovary 1 month and the right ovary the next month accurate?
Only one ovary actually ovulates each month. However, the pattern is random.
I never knew that women have such a complicated reproduction process.
Well, now you know.
Exactly. This is why we need you here to guide us through this process. Here's another question regarding intercourse. Does putting pillows under the hips during and after intercourse enhance fertility?
Sperm are already swimming in cervical mucus as sexual intercourse is completed and will continue to travel up the cervix to the fallopian tube for the next 48 to 72 hours. So the position of the hips really doesn't matter. The ability of the sperm to swim does not depend upon gravity.
This is question sent by email. I've never had symptoms of a pelvic infection, so I can't have blocked tubes. Is that true?
Many pelvic infections are silent and have no symptoms at all, but can cause damage which is often irreversible to the fallopian tubes. This is why testing the tubes to check if they are open is so important in the infertility workup.
Is it true that a man's sperm count will be the same each time it is examined?
A man's sperm count will vary. Sperm number and motility can be affected by many factors, including time between ejaculations, illness, and medications.
The next question is pretty common among guys, I think. This man says, I have no problems having sex. Since I am virile, my sperm count must be normal, so why should I get it tested? Is that true?
No, there is no correlation between male fertility and virility. Men with totally normal sex drives may have no sperms at all. This is because the compartment which produces sperm in the testes is completely different from the one which produces the male hormone testosterone, which is what drives libido.
Interesting. I always thought they only have problems conceiving if they have troubles in bed, but I guess that isn't the case.
Nope, not at all. This is still one of the most common misconceptions regarding male infertility.
Fair enough. Let's move on, shall we? The next question is rather controversial and I've heard it debated often. Some people say that infertility treatment should not be offered in India because there are too many babies in this country already. Why exacerbate the population problem by producing more? What do you say to that?
Personally, I think that the right to have children is a fundamental right of every human being and a very basic biologic urge. Just because a neighbor has too many children should not deprive the infertile couple of their right to have their own.
Great answer. Okay, back to men's infertility. Is it accurate that azoospermia or lack of sperms is a result of excessive masturbation in childhood?
Masturbation is a normal activity which most boys and men indulge in. It does not affect the sperm count. You cannot run out of sperms because these are constantly being produced in the testes.
I'm sure our male viewers out there are breathing a sigh of relief. What about the issue that infertility is not a medical illness and treatment is usually not covered by insurance?
Infertility is a medical problem, which is often amenable to medical treatment. Insurance should cover the treatment costs. Just because it's not as common or well known as other major medical issues doesn't mean it should be overlooked.
Okay, now for the final question. Many people think that IVF is too expensive for India to be able to afford. What do you think?
IVF and related technologies are undoubtedly expensive, but then, so is heart surgery. Yet, no one objects when over 2 rupees lakhs are spent to try to salvage the heart of a 70-year-old man whose life expectancy in any case is only about 5 years and is not extended by the surgery. Why then should medical technology not be used to help couples in their 30s, who have their whole lives ahead of them, to have their own baby? In fact, IVF is a much more cost-effective use of medical resources than a number of other accepted surgical procedures such as joint replacement surgery or kidney transplants.
I guess that wraps up our interview session. Thanks again for coming, Dr. Malpani. For further details and information on the subjects we've talked about, go to drmalpani.com.